Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everyone. Merry Christmas. I hope you're doing good. We are live on Facebook. Please share. And also you can check out us on the Medical Collective. I'm Dr. Keisha, and I'm here with Dr. Sharon. How are you, Dr. Sharon?
I am doing great.
Yeah, it's like the holidays season. Cold one day, warm another in Texas. And right now we're enjoying cold weather, or trying to enjoy it.
It's not that
but I'm
cold.
glad to be here. I'm not a cold person. Listen, I grew up in the Midwest, so they always tell me, listen, you know all about cold. Yes, but I'm not trying to remember it. Like in a couple of weeks, I will go to Kansas and I will hibernate inside, but I do not enjoy the cold weather like other people. I do not. No, not at all.
Yeah, I mean, it's not that I enjoy cold weather, but I still don't find it that cold. I know overnight it went down to the 30s, and then this morning when I left to go work out, it was I think the high 40s.
40s?
Mm-hmm. And
didn't we get in the 50s today, Dr. Sharon?
No, we did. And then today we got up to the 50s. Now it's actually 55 degrees according to my phone right now.
Oh,
right. So,
okay.
I mean, I didn't wear a jacket. I have on a long sleeve tee, and I wore just a sweatshirt or something like that over it. So it's not like I pulled out a winter coat or something.
Yeah. Well, it's enough. It's enough. We don't normally have coats here. If we have them, it's probably for just a couple of days. I think I can count the number of days I wear a coat.
Yeah.
In Texas, in Houston.
That is correct.
Yes.
Yeah, I usually will wear my coat when I travel, in the winter. But other than that, not really, no.
So today, Dr. Sharon, we have a couple of updates before we get into holiday health. I was like, let's have something lighter, because I think sometimes we've had quite a few serious but important ones, like the vaccine-preventable illnesses that we had last time, and so much more things concerning the election. But today, I want to be more relaxed and talk about holiday health. We got a couple of updates. And again, those who are in the audience, send in your questions or comments and follow the Medical Collective. Okay, here's the first one. This was a big one. And this actually I love because there's two parts to it. First of all, we heard about Anthem insurance under Blue Cross Blue Shield out of a few states that had purported they were going to have a policy that was going to put a limit, Dr. Sharon, on anesthesia time services during a procedure or surgery, which is interesting. But you know what happened? The backlash came in. A lot of people use their voice, like here. And because of that, they did put out a statement within 48 hours saying they were no longer going to do that policy. So what are your thoughts on that, Dr. Sharon?
I think they heard the public loud and clear, right? Because I'm a surgeon. I operate. And even before this, with a time limit, I'm not rushing my surgeries. The whole goal is safety. Yes, we want to get in and out as soon as we can. However, if you rush and you do things that are unsafe or put your patient at risk, then the potential for mistakes and injury increases. Then guess what? Your OR time is going to increase anyway. Or if the injury is not recognized then, it's recognized later, you're still going to have to take the patient back to the operating. So I said that even before they even reversed course. I'm like, I'm not rushing anything. And I did post that somewhere on social media, and some one even commented, well, the patient is going to get a huge bill. I get that. And I sympathize with that. But I'm not going to put my patient at risk by rushing through a surgery. I don't think I'll be able to sleep that night. Thinking, did I miss something? No, I was not going to do that anyway. So I'm happy that they reversed course and at least listen to the public outcry, because that was just completely ludicrous for them to think that I'm going to try to get through a surgery in less time. And then in addition to that, you can't predict. Sometimes I meet a patient who has had previous surgeries, and then you go in and it's a complete mess, and you may need to call in like additional services like a general surgery consult or even a urologist. If you're worried about the ureter, like in my case, and as an obstetrician, so that is going to extend the surgery time, right? But we do what's safe for the patient. So that's what I've done. And that is what I'll continue to do. I have no intentions of rushing through anything, and I'm just not going to.
Yeah, I'm with you.
Yeah.
No rushing. And I will tell you this. I don't know how they calculate the time, but I have tried to time and calculate a frozen section, which a frozen section is when a surgeon's in a surgery and there is something they need the pathologist for, whether it's margin check, seeing if there's actually tumor, making sure everything's clear. And they will sometimes give us a heads up. But I have not perfected the timing because things always arise, whether it's adhesions, whether it's more difficult navigating things, and then doing the frozen section. So I find it interesting that insurance companies can give a time to how you guys work, because I don't even know.
You're on the ground with us. You're on the ground with us, and you can't even figure it out.
I still to this day. And some surgeons may take longer than others, but that has nothing to do with what they should get recovered or reimbursed for. The next current health news that I wanted to share is the recommendation. Dr. Sharon, it's for you. The United States Task Force had put forth, and we heard about this earlier because the FDA had approved a couple of home collection kits for cervical cancer screening. But now they have this week put forth a recommendation that they are supporting high-risk HPV testing as the preferred method for cervical cancer screening. But this is in age 30 to 65. And I'm sure that Dr. Sharon, she can put some notes onto this. And this is a draft recommendation as of now.
I partially agree with like self-testing for HPV. I think that will help because if you give the person the opportunity to test at home and participate in their care at home, I think that would actually encourage more participation, right? I still think that does not replace a physical exam by a gynecologist, like someone actually taking a look at the cervix.
Very true.
Because, even if you're HPV negative, what if you have a polyp? I've seen polyps at the cervix and different things. So that still does not exclude a physical exam. It may mean, I can't go in today, may not be able to go in next week, or even in a place where access is limited. I think that home HPV self-testing can help, right? But I don't think it means you should never, ever, ever go back to the gynecologist and let me just do my home HPV testing.
Yeah. Yeah, very true. And I will put a couple more points onto this. As testing is home testing, and I want to say it's not home testing, it's home collection testing.
Yeah.
Okay, because we do have the home test that we have for SARS-CoV-2, right? COVID. We have the home test. I'm fixing my hair, y'all. We do have the home test as well for both flu and COVID, if you don't know. Yes, there is a combined test for flu and COVID. That's home test. Collection kit will say collection on it, meaning you're doing it at home and then you're collecting it to send it off. So it's mail-in. The problem is that people may get that confused. It's not actually a home test where you're waiting for results, because these tests do go to the lab and they are genetic tests to see if you're high risk or low risk. And some insights are that they did recommend this, as we said, for 30 to 65. So that's not below 30, because they're, again, thinking the first time you go in should be with an obstetrician gynecologist like Dr. Sharon. It should have visual looking at the cervix and doing a pap smear. Public comments on it are open until January 13th. So if you want to put your comments in on how you feel about this, you can. And that's a little bit on that. All right. Anything else on that? No. My nephew just put in a comment that he wanted to talk about. So we have an additional news story, but I quickly want to talk about disease X because, again, we are global and it's important. We're up to date. We travel, people travel here, and we rely on other places for commerce, as well as understanding how they are dealing with disease processes. So there is a small area in the Democratic Republic of Congo, and this area has had an outbreak, and it's called disease X, and I'll tell you why. At first, I thought disease X, they haven't isolated. It's disease X because the people are presenting with a myriad of symptoms, and it's mostly younger people, Dr. Sharon, and under 5. And what they're seeing is that fever, headache, chills. And the problem is that out of the hundreds of people that have been tested or found to have this illness, 30 have passed. The number is changing, but they're having to verify if it's due to disease X, what these people are passing away from. So there is at least 29 that have passed away, and 17 of those are children under 5. 17 of them.
Wow.
So that's concerning. They also did find that about 11 of them had also malaria. So this is not, they had malaria and that's it. It's that they had malaria and possibly this other disease. So they're not attributing all of this to malaria symptoms. Another thing is that the problem is that, first of all, finding out about it was delayed, Dr. Sharon, months. Because of where this village is located, there's not access to reporting and finding about the disease. In addition to that, testing. So getting to the logics around getting to the place, the first time they tried testing, the samples didn't last. They were not viable. And so their problem has been that the logistics of everything. So right now they're trying to test them, send them off, and we'll find out. Hopefully, I'm hoping within the next couple of weeks what this disease X is. So it's disease X. Any thoughts on that, Dr. Sharon?
No, I think we just have to wait and see what the results of the testing is. But I mean, I can definitely see where lack of access or can really delay testing, care. So we'll just wait for the results, and hopefully it's not too crazy per se.
Okay, another thing that we were going to talk about is the CEO, and I think we're going to do that towards the end because I want to get into holiday health quickly because I think this is important. And, both of us, if you don't know, in addition to being board certified physicians, I'm a personal trainer, and Dr. Sharon is into aesthetic medicine and obesity medicine. So I think it's important that we have this conversation. So first is just navigating holiday health. Physical wellness during the holidays can be hard. I think some of it is that you feel fatigued. For those of you that are in cold areas, I understand. Getting out can be depressing. There is something, cyclical about the change in the weather and the sun patterns, and we're not seeing as much daylight. So I think that one thing to do is to start off eating right. So we could talk about that, is about eating right to make sure your nutrition is right, because a lot of times the things that we're eating or not eating can affect our mood, as well as exercise, or thinking, if it's icy outside, what are our options? So what are your thoughts, Dr. Sharon?
For me, I definitely good nutrition and, keeping up that pattern of good nutrition. One of the things that I recommend against is that sometimes, especially during the holidays, we know it's like, for me, I celebrate Christmas, and we'll basically, quote unquote, hold your appetite for that big meal. I actually can't do that. I find that when I do that, I don't eat as much. It doesn't work well for me. So that may not work for a lot of people, just waiting and holding for that big meal. No, I don't, if you're going to have, let's say your dinner time is at 4:00. No, I don't expect you to have a big meal at 2:00. You just won't be able to eat dinner at 2. But even like a smaller lunch, will be okay, instead of just having breakfast and nothing else after that, or just not, or even not having breakfast at all. That I don't recommend. Yeah. Another thing that helps your mental health during the holidays, because some people get stressed out in the holidays. You're hosting family and friends, and you have all this stuff to cook, gifts to wrap. Kids may be running around everywhere. Is one of the things to me is to stay organized, right? Prioritize and ask for help and delegate, right? Because sometimes you're just one person, you're not going to be able to get everything done. But I think just knowing where to ask for help is a good, good thing. And then also practicing mindfulness, right? Just taking a few minutes, centering yourself also. Meditation. And I think I'm missing my meditation class.
Oh, no.
It's okay.
For me, I'm sorry.
No, it's actually, no, it's not. I still have an hour. I don't even know if I'm going to be able to make it anyway, but that's okay. So, mindfulness also help, and don't aim for perfection. And I know that's sometimes hard not to do. But just trying to be perfect is not necessarily a good thing at all. I think it stresses you out more than anything. Stay active, short workout, and if you're in a cold, dreary place, I know it's maybe hard to get outside, but you can stretch in your home. You can stretch in your living room. You can use small handheld weights, and if you don't have those, you have something in your house that can give you resistance. A bottle of water, a can of something, cranberry that you might use. So just staying active also really helps during the holidays.
Yeah, I think it is too, is trying to get a schedule down, whether that's a different schedule, because people are going to parties. People may be dealing with loss. And so it's like trying to find a schedule amidst all of that. So I completely understand. Something else that we need to talk about, while we're talking about that is we can do stuff with families. So walking together. Something that we did during Thanksgiving was we all went, when my husband's family was in town, is we went like light seeing. So we went to go drive around the light seeing, and then got out and walked and stuff like that. So that's an activity. It's also involving increasing your heart rate a little bit. Dance-offs. Me and my daughter are king of that. I do a couple dance-offs with her, and I have videos. Like during the pandemic is when we really started the dance-offs, and we would FaceTime my nephew, her cousin, and they would dance off. Oh, those are hilarious. So make it creative, y'all. Get involved with your family. All right, let's talk about holiday safety and emergency prevention. First of all, within the home, outside of the home, and especially for females, we need to talk about safety on different levels. Within the home, safety, I think sometimes is making sure as far as things are plugged up. Listen, we have a whole bunch of lights outside, and then we have like a space heater for the dog. So make sure that things are wired safely. Don't try to cut corners with things that you get and the wiring you use, because a fire could happen. In addition to that, safety as far as locking doors. Have you guys heard of the bandits? What do they call them? The package bandits or the porch bandits?
Yeah,
So
that is,
according to Ring, they are hot commodity right now.
yeah, that is quite prevalent at this time of the year with these package bandits where, let's say you have something delivered, someone will be waiting and they'll just snatch your packet. Yep.
So in addition, I think about the stealing of the packages is getting in the door. We see more thefts, we see more break-ins of car, but your safety as well. So be aware that in addition to small petty thefts, we don't want to make sure that there's a break-in or, you have kids home and things like that. And what about pregnant persons? Are you seeing more because they're wanting to go out shopping, reaction time's not the same, or they may have a lot of packages? They may look like the more vulnerable type to be profiled or attacked.
Yes, they are. I would definitely say go out with another person and try not to carry packages that are too heavy or even bulky, especially if you are, you have you're more advanced in the pregnancy, so to speak. So I wouldn't recommend that. And just the same general safety precautions that you would do even if you're not pregnant. Another thing that I would recommend I love natural Christmas trees. I do. I love it because it just smells so nice.
So good.
So good. But make sure you're watering that tree because it can dry out. And if you are running those lights, that becomes a hazard and it becomes a fire hazard. All right. And then another thing I'm going to recommend is for you to have fire extinguishers and know how to use a fire extinguisher. Right?
Yeah.
Yeah.
I mean, a lot of us can probably say, do we know how to correctly, when to use it to? And, the type of fires that happen on the stove. Like my daughter the other day had the gas range on and just walked away with oil on the pan. Something the mama since told me to go in the kitchen to see what she was doing. And there was a hot pan burning with oil.
Yeah, that is hazardous.
Yes,
I'm glad you caught that on time.
Yeah, and a lot of people want to bake and cook and all of that, so we just have to be aware, especially what our kids are doing. Mental health during the holidays is a big one. Everyone thinks it's the most happy time of the year. First of all, there are several jobs, quite a few jobs, that this is the most stressful time. And when I was in academic medicine, and when I was at my former place, it's the most hectic time of the year. Busy in the emergency room, busy for surgeries as more people are getting procedures done before the end of the year, right? They've met their deductible. So it's very busy in that sense. Then there are people that may be working or going through an illness or a loss of loved one. So it's not always the happiest time of the year that people say. And then those pregnant persons that may be dealing with things, having a difficult pregnancy or going through a diagnosis, it cannot be the happiest time. So I know for me personally, recommendations are having a support system. Number one, having people you can talk to and lean on during this time and trying to pace yourself. Because I think we make these expectations. I watch Hallmark and we expect that we're going to have these Hallmark Christmases and it doesn't happen like that. What about you, Dr. Sharon?
I think sometimes during the holidays, people have unrealistic expectations. And I think that is the cause of a lot of stress, right? So I think if we rein in those expectations, I think that will definitely help, right? Prioritize, delegate. Bigger tasks can be broken into smaller tasks. And sometimes the things that you don't get to do, then you just don't get to do them. You know, so that's I personally don't get stressed out during the holidays. It's like my favorite time of the year. And I
Yeah.
don't stress myself out about doing things that I have no control over. Or let's say I am on call, then I got to travel because most Christmas I am usually, with my family. And I may not get there until about maybe Christmas Eve or the 23rd or so. Even though sometimes I try to get there a couple of days before so I can help my mom and, help the family with, things that's needed. But I mean, I don't go Christmas shopping. I think I'm going to drive myself crazy trying to go into a store on Christmas Eve to buy what? Nope. Yes, I might have done some stuff online, buy some things online, but if I didn't get to, oh well. For me and I know for my family, the important thing was that we were all together and just sit and eat and laugh. Like for the smaller kids, yes, we would, get them gifts and stuff like. I can't even tell you the last time I got my sister a gift for Christmas. Sometimes it's like later, "Oh, what do you want?" And then I'm like, okay, I'll go get it. But to try to do cartwheels with this unrealistic, no, I don't. It's like, what are we going to eat? What's on the menu? So those are the things that we focused on. Yeah. So you have to kind of prioritize what's important to you. And that's how we did it.
Yeah, that's great. Great advice. I pray and send thoughts and prayers to those who are dealing with difficult things right now. But I think taking it one day at a time, and being kind with yourself. If you want to sleep, sleep. If you don't want to go to a party, don't go to a party. But I don't think that we need to make this time a stressful time. And sometimes it really can be. I know what I was doing when I was working, and it was so much. Like, we saw 2 to 3 times the normal amount of cases we saw during the holidays. So I would put holiday music on when I was driving because it was so stressful. I would say, okay, I'm not going to be able to. I didn't even have time to go shopping because I was so tired when I got home. So I did shopping online and made that fun with music or something. But don't pressure yourself. I know when we have kids, we want to have this expectation of what we can do for them, but we can only do as much as we can. So
yeah,
thank you for that, Dr. Sharon.
Well, and maybe for me, I'm not a person who's gonna start thinking about the holidays and shopping in October, November. And I think probably partially because of what I do and how I work. I don't, and maybe that's something I can change. Right. So I'm not the one who's gonna, it's November 15th and I need to start Christmas shopping. I'm not that person. It will be like the two days before. Like, we'll get it later. What are we going to eat?
I know, right?
What's on the menu? Do we have cake? Yep. So yeah, that's kind of how I I've dealt with it, and my family have dealt with it, and we don't go crazy about you having to buy all these gifts, and trying to fill those expectations. And then, truth be told, a lot of times, January 1st, people are broke because they spend all their daggone money at Christmas.
Listen, the after holiday low is so real. The day after, it's like this. Sometimes people feel this I don't want to say postpartum, but post-holiday blues. It is like a postpartum blues. Like you've done all this, hyped it up, and then it's over with. So I completely agree.
Yeah. And, like people have these expectations and then, they go shopping and mount up all these daggone bills and, and spend money that they don't have. And if the economy is so daggone bad as people said it was during the election cycle, then should we really be out there spending money? But anyway, that's for a different conversation.
Yeah. Yeah. So everyone, take note of this. Take your time during the holiday season and enjoy as much as you can. Here is the next one that I'll talk about is party safety. For those that are going to party, if Dr. Dan was here, I would say in his voice, but he would say, please grab an Uber or Lyft. When I was doing my rotations through autopsy, these are the times of the years where we should not be seeing as much death as we're seeing, or accidents. So please, we have Uber, Lyft, we have so many different ways to get around, the black car, whatever would have you. Even with one drink, even if you don't think that it bothers you, please get a ride wherever you can, because alcohol, in addition to impaired driving, can lead to other things. We see more fights, more aggression, all kinds of things. So please try to do what you can to monitor that. I think I see a lot when I go to events that it's the effect where you see someone else doing it and then you do, and you really don't even want another drink, but then you do another drink, and it's just so fun. And then it's not so fun afterwards.
Right? Yeah, no. I agree. And then another thing in terms of holiday safety is watch those little kids running around the house.
Oh, yes.
Right? Keep them out of the kitchen while you're cooking. Because it's really easy for kids to be injured. And one of the big things I always did when my nieces and nephews were smaller and they were running around the house, like if I had always hold a knife upwards, not down, because these kids can run around and run into it, and that's an accident that you don't want. Because sometimes, the kids they're excited, they're gonna run around and, do things like that. But so those little safety like that, the fire safety, the cooking safety, keep them out the kitchen. Beware of having like a knife or sharp object in your hand. So that's for the kids. The drinking at the parties. New Year's Eve is another one where people tend to drink a lot. Uber, take Lyft. I don't know, call a pigeon, ride a donkey, something. But do not get behind the wheel of a car if you've had, sometimes I think it's kind of hard. You don't judge, right? Or you're not really able to judge in terms of like how much you've had, because but you have to be mindful of that, and just be aware of those things.
Something else, to kind of close stuff up as we talk about, safety and all of that and the holidays and Hi to My Mom, is don't forget the simple thing of love. There's a lot of hate going around, and I guess we should end with this story. And hi to my nephew if he is listening, because he did want to bring this up, is that in the midst of all of this, there's been a lot going on. We've been talking about the election. We've been talking about so many other things, the outbreaks, more outbreaks than normal, more people getting sick. And out of all of that, aggression, there can be lives lost. And one of them was the CEO. And this story, I think, just to close this off, is only because this story brought about, I think some things happen sometimes or come to a head to bring about deeper problems in our society. And I want to send condolences and prayers, of course, to the family of the CEO that lost his life recently. that was a health insurance, the CEO of United Health Group. The individual has been in the news, Luigi, that has been accused of this crime. And there's been a lot on both sides. And this is the beauty and the perils of social media, is that we're seeing people praising him, and then we're seeing people that are not praising him. And a lot of mean stuff is being said. So that's why I also stay off of Facebook. I don't read all of these comments because of that. But I can tell you this, that there's a broken healthcare system, and insurance company is part of it. And Dr. Sharon, I'm sure you can attest, but I will say, as one who went through a lot of procedures and having to get stuff for breast health, it's frustrating when you're trying to get something done. It's already enough. We tell people go to the doctor. They have pushback. We have groups like Black women and other groups that are disproportionately affected by healthcare and how they're treated. And then they take time off from a job that maybe is hourly pay. They try to get in, they try to follow it, and then, well, health insurance doesn't cover it. Or, well, you know what, you're going to have to wait a little bit more. And then the doctor's having to take away from the little time they have per patient to try to talk to the insurance company to get something to go through. So as far as insurance companies go, it is something we have to improve. And I'm sure you can tell stories, or maybe you have a brief thing you want to share, Dr. Sharon, because it's like, to me, it breaks in my heart that it got to that point, that someone's in so much pain that they're like, no one's listening to me. And the healthcare insurance company is making decisions as a non-healthcare professional.
Yeah, I think probably the highlight of this whole situation will be how the healthcare entities really, to me, work against a patient's interests. And by no means do I condone what happened to the CEO, but I mean, I completely get the frustration of the patient. Sometimes they deny things that don't need to be denied at all. And that just puts a roadblock and just inhibit us from taking care of patients. But hopefully on the other side of this, we can really dissect and dive into this whole broken, shattered healthcare system, and maybe, hopefully, something positive will be able to be pieced together from this, and maybe we can make some changes, because this is what that young man dealt with with United Healthcare is what we deal with on a daily basis. So hopefully from this tragedy, we can actually begin to move the needle, do something, so that we can take better care of patients. And that's my spiel on that.
Well said, Dr. Sharon. And I think that there's a lot of learning that we can do from this. And I hate hearing the stories. And we hear them from you. I hate knowing, as a doctor, it's already difficult enough. And then being in a situation, as we've heard also a story of a patient needing a transfer to a better facility and being denied because of a health insurance company. It shouldn't get to that point. Practicing medicine is hard enough. Being a patient and living is hard enough. We've got to do better. And maybe this is the wake-up call that insurance companies need. It's not just about greed. So Thank you for that. All right, everybody. I hope you guys had an amazing discussion, listening in with us. And thank you for being patient as we deal with the difficulties, but you should be able to look at the live. But what you can do is watch it on YouTube. And you can listen on Apple and many other platform streams. We've got 8 episodes, now this 9th one under our belt. And please stay tuned for the upcoming year. We got surprises. Musical guests will be coming on to help complete the show and navigate things. But in the meantime, everyone, take care, be safe, and send your questions into the Medical Collective. You can either go to Instagram or the Facebook page or LinkedIn, and we'll make sure that we put it on the next show. Thank you.
Have a happy holiday, everyone.
Yes, happy holidays, everybody. Enjoy. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast